Hi, I'm Dr. Marty Willmitch, and I want to welcome you to the thyroid recovery portion of our website. The reason why we put this program together is because thyroid problems are rampant in our country. Approximately there's 20 million people that are currently suffering from hypothyroidism alone in this country. That's 1 out of 13 people, and unfortunately it's even more common in women. The recent statistics says that 1 out of 8 women are suffering from hypothyroidism, whether they've been diagnosed or not. What are some of the common symptoms associated with thyroid problems? Well, it's things like fatigue, decreased energy, weakness, weight gain, the inability to lose weight, coarse dry hair, hair falling out easily, cold hands and feet, muscle cramps or frequent muscle aches, constipation, depression, irritability, memory loss, abnormal menstrual cycles, headaches, swelling, even the increased susceptibility to colds and flus or other infections. Now, the reason why you're watching this video is because you've probably already been diagnosed with a thyroid problem and you've already been placed on some form of thyroid replacement hormone, things like Synthroid or Armour, Levoxyl, levothyroxine, Cytomel. There's a bunch of different medications and they all do the same thing. They're basically just giving a supply of thyroid hormones exogenously. And the reason, again, that you're watching this video is that you've probably been diagnosed, you've probably been put on these thyroid replacement medications, and you're still having the symptoms associated with hypothyroidism, even if your lab tests are now showing up in the normal range. And that can be extremely frustrating to not only a doctor, but especially to the patients, especially to you. Reason is because once we get diagnosed with a condition, we expect to start feeling better when we get put on the medication or put on a treatment protocol. But the reason why you're still having symptoms associated with hypothyroidism, even once you've been started on the medications, is because there's actually 7 different patterns of hypothyroidism, or more realistically, or more to the point, there's actually 7 ways the thyroid gland can become dysfunctional. And only one of those ways, or only one of those patterns, can be effectively managed or treated by using the thyroid replacement medications that are on the market today. The reason for this is pretty simple. Our thyroid glands are our body's basic metabolic gland. It sets the metabolic tone for the body. And it's extremely fragile, it's extremely sensitive. The thyroid gland can become dysfunctional with subtle changes in our body's chemistry, our body's hormonal responses. It's extremely fragile and it's extremely weak. And unfortunately, once it starts to become affected by some of the common causes of thyroid problems, we're going to start to see almost immediate symptomatology associated with a decreased or a suppressed thyroid function. So like I said earlier, there's actually 7 different patterns of hypothyroidism, and only one of those patterns is effectively managed with thyroid replacement medication. That means that if you get diagnosed with hypothyroidism and you get put on the medication and you start to feel a little bit better and you start to get back to your normal life, congratulations, you're one of the very, very few people that's going to get any relief with the traditional medications for thyroid problems. Unfortunately, the vast majority of hypothyroid patients feel absolutely no change in symptoms. They feel no better once they start the medications, and the reason being is that something else is going on inside their bodies that's causing the thyroid gland to malfunction. And when that happens, the medications are not going to help them. And that's just a sad fact associated with thyroid problems today. What we do in this office is extremely different. What we specialize in is actually looking at the body from the inside out, top to bottom. We look at all the body compositions, all the blood chemistry panels. We run specific lab tests, and all these tests are derived or meant to show areas of the body that are not functioning properly that can ultimately impact the thyroid gland, causing particular thyroid symptoms, just like we talked about earlier. And once you really recognize and find those problems that can ultimately affect or negatively affect the thyroid gland, then you can set a course of functional therapy to fix the underlying causes of the thyroid malfunction in the first place. And that's what this program is all about. Again, thyroid problems, there's 7 different patterns of thyroid problems in this country. Only one of those patterns can be treated successfully by using thyroid replacement medications. The other 6 patterns are going to have absolutely no change in their symptoms once they get put onto the medications. That's where we come in. That's where this program is meant to help. Our program, again, is set up to find the underlying causes that can ultimately trigger abnormal thyroid function or hypothyroidism. So if you're one of the people that's currently been diagnosed with hypothyroidism, been on the medications, still not feeling yourself, still having the symptoms associated with hypothyroidism, there is hope for you. Our program is designed specifically for patients like you. Because of that, I've put together an informative DVD that explains in more detail thyroid problems and the reasons why you do not feel better even with the medications that you've been prescribed for your particular condition. If you're interested in learning more about what we have to offer for patients just like you and the reason why our program is so successful in treating patients just like you, all you have to do is request the DVD. It is totally free, and you can order it or request it in one of 2 ways. First, you can call our office directly. The number here is 813-933-6481. You can speak to the staff, give them your name and address. They'll get the DVD in the mail immediately for you. Second way you can request the DVD is to just register on the website. Directly below this video, there's a place you can put your information, name, address, phone number. We'll get that information, put the DVD in the mail immediately. When you get the DVD, I'm going to ask that you open it up and watch it as quickly as possible. On the DVD, there's a time-sensitive offer that I make for everybody that requests a DVD. And again, it's time-sensitive, so I don't want you to just get the DVD, put it on the counter, and say you're going to get to it next week or the week after. Again, there's a time-sensitive offer on that DVD, and I do not want you to miss that offer. Okay? So if you're interested in learning more about what we do to fix thyroid problems, if you're tired of generally being sick and tired, and you want answers, you want to understand why you feel the way that you do, request the DVD. It explains everything in entirety, and I will tell you, it's not very long. It's only about 20 to 25 minutes, but it's jam-packed with information that you need to know in order to get back to normal. So again, I want to thank you for just watching this video. I'm Dr. Marty Willmitch, and I'm here to help.